1.
Hello, everyone. I'm Lieutenant Governor Susan Bysiewicz, and this is a meeting of the Interagency Council for Ending the Achievement Gap, and it is hereby called to order. And I thank everyone for joining us today. It's been over 7 months since we started a new type of living in response to COVID-19. Not just here in Connecticut, but all over the country and the globe. And we are coming together virtually again today, as we have for our June 23rd meeting. And I hope everyone is remaining socially distant, safe, and well. The governor and I continue to be just impressed and amazed with the incredible work that our agency commissioners, state employees, and nonprofit partners are doing. As you know, they have played a very critical role in helping us fight the virus in Connecticut. Schools have been open for nearly 2 months now with learning environments that are different from before. So our work at the council is particularly important now at a time when each of our school districts is working to overcome the challenges of the pandemic and to create really a safe learning environment for our children and our communities. No child in Connecticut should be left behind, and it's important that we work collaboratively to have an equitable learning experience for all of our students. So let's start off today by having the council members and designees introduce themselves. And Carrie, would you mind calling on each agency so that they can respond when prompted? And Carrie, I'll leave it to you to do our roll call.
Okay, thank you, Lieutenant Governor. I'm going to start with the Connecticut State Colleges and Universities, Department of Administrative Services, is there someone here? I think anyone here? I didn't hear you. You have to.
Sorry about that. I was muted. Doug Casey there, representing Department of Administrative Services from the Commission for Educational Technology.
Thank you, Doug. Next would be the Department of Children and Families.
We are here. It's Commissioner Durantes, and with me is Deputy Commissioner Michael Williams, and I believe our Superintendent, Matt Boland.
Thank you, Commissioner. And next would be the Department of Economic and Community Development. And the next is Department of Housing. Department of Public Health.
I'm sorry, just really quick, Kari, I do see Shantae Hanks. So I do believe Department of Housing is present. Shantae, your mic looks like it's unmuted. You just have, yeah, I see the wave. So she's present. I don't know if maybe there's something wrong with the mic.
Okay, thank you very much. Department of Public Health, please unmute. Department of Social Services.
Hi, good afternoon. This is John Dillon. I'm one of 2 individuals representing Department of Social Services. I'm the Director of the Office of Child Support Services.
Hello, and I'm Peter Hadler. I'm the Director of Program Oversight and Grant Administration at the Department of Social Services.
Wonderful, thank you. And the Judicial Branch.
Hi, good afternoon. This is Patricia Nunez, designee from Chief Justice Carroll for the Judicial Branch. Thank you.
Thank you, Patricia. Office of Early Childhood. Office of Policy and Management.
Good afternoon. I'm Holly Williams. I'm Secretary McCaw's designee from the Office of Policy and Management.
Thank you. Welcome, Holly. And the State Department of Education.
Good afternoon, everyone. Miguel Cardona, Commissioner of Education, and I'll let my colleagues from our wonderful team introduce themselves. But I want to thank Matt Falconer, who's behind the scenes, for helping organize the meeting online.
Thank you, Commissioner. Charlene Russell Tucker, Deputy Commissioner here at the Department of Education.
Hi, good afternoon. John Frassinelli, Division Director at the State Department of Ed.
And I'm Kari Sullivan, Education Consultant at the State Department of Education. Is there anyone else on the line who has not been introduced? Okay, well, that concludes our roll call. Back to you.
Hey, Kari, thank you very much. And I'll just ask one more time if anybody else has joined who hasn't introduced themselves. I think we have everyone. Great. So at our June meeting, I asked that each agency submit to us a memo commenting on the results, statements, and policy recommendations in the task force report. And we followed up with most of you asking that you offer commentary on certain provisions that could touch your agency. And so before we move on to review today's agenda, I just want to thank all of you for the time that you put into your memos and to formulating your responses. The task force, you might remember, was completed in 2014. So it's been over 6 years since those recommendations were made. And we've gone through a change in administration, including at the agency leadership level. So I appreciate that some, if not most, all of us did not start off on this council already familiar with the recommendations overall, let alone how we might impact the changes in agencies. So I appreciate that a lot has happened in 6 years, and things that have, could have made sense in 2014 may be looked at a little differently now. And so I understand that some matters may be more difficult to address than others, whether it's due to lack of funding or human resources, even before we were hit with a pandemic. All of that said, I can already tell you that some areas appear to have progressed nicely. Right now, our focus is on understanding where we are today in an effort to inform how we're going to consider the recommendations as a council. And even if the topic does not quite fall within your agency's perspective or offer resources of information that might be helpful to addressing the matter overall. And so we ask that you not hesitate to consult agencies that are not on this council if it's appropriate. Of course, I'm happy to reach out as well if there's a non-council agency that we think can be useful to what we are looking at here. So with all of that in mind, let's proceed with reviewing today's agenda. So we have just completed the welcome and the introductions, and we will shortly move on to a discussion on 3 of the results statements from the task force and their corresponding policy recommendations. Today we have 3 subject areas, and they are poverty, hunger, and food insecurity, and social emotional health prevention and intervention. And so for each of these subject areas, we are going to read the results statements, and then we're going to discuss each policy or recommendation one at a time. So we will start with reviewing the responses received, and then we are going to open it up to others. Kari's going to take notes for us on the discussion, and we would just want to thank you all in advance for capturing our conversation today. Thank you, Kari. And once we've reviewed the 3 areas, we'll do a wrap up by identifying what the next steps are. And before we adjourn, we'll confirm our next meeting date, and we will review what we think the agenda is going to look like for that meeting. So before we move forward, does anybody have any questions? Okay, so with that, we are going to go ahead and we are going to start with our first topic, which is poverty. And the results statement is that children will live with their families in economic stability. So we've got 10 policy recommendations to support this goal. And we've received some comments from DSS, from OPM, from the Department of Education, and also Office of Early Childhood. And the first policy recommendation is to ensure income tax-based assistance for workers, including Connecticut's existing refundable state earned income tax credit to supplement low wage earnings of parents. What we're going to do is we are going to ask DSS if they would like to talk a little bit about its recent support for the volunteer income tax assistance campaign. So do we have somebody from DSS who can speak to that?
Hi, this is Peter Hadler. I can speak briefly to this. Wanted to note that yes, the department was very supportive of the virtual VITA campaign to inform state residents about the availability of free assistance in tax filing and recovering the economic stimulus payments that were issued to families at the beginning of the pandemic. We sent out correspondence to approximately 300,000 households across the state with follow-up reminders and communications to all of our families who are receiving SNAP and cash assistance. So that's the status of what we did up to now.
Great, that is great. Thank you for sharing. Is there anybody else who wants to comment on the volunteer income tax assistance? Okay, very good. So this is one where we probably also want to get the perspective of the Department of Revenue Services. And though they're not represented on our council, we are going to ask DRS if they have any thing to add on that point. The second policy recommendation is for families with incomes of less than 50% of the state median, provide child care subsidies. This will increase employment as well as will reduce family expenses. So OPM, OEC, and DSS all mentioned the Care for Kids program, including some of the challenges that have been brought about by COVID. If there is somebody from Commissioner By's office, we could start out briefly describing that program, and then maybe DSS can tell us how we connect people to it before we go to OPM. So do we have anybody from Office of Early Child Care? Okay, well, if we don't, I can say this, that we have lost an estimated 45,000 quality child care spots because of the pandemic. We had multiple child care centers and daycare homes that closed their doors and did not reopen. And I know that the Commissioner By has been working together with the governor and I and Rosa DeLauro and Richard Blumenthal to get $50 billion nationwide for child care assistance, recognizing that in Connecticut and across the country, we have lost many of those spots. And we do know that towns are being very creative. As the person who chairs the Council on Women and Girls, I have been to some child care centers, including those sponsored by the YMCA or the YWCA, and visited a very interesting place that the Glastonbury Public Schools put into place in literally 6 weeks at a school that they have that is not occupied any longer. And it was to help teachers who had young children and weren't going to come back to work. And then after the teachers had help, they went to allowing other people in the town of Glastonbury to make use of those childcare spots from infant all the way up to I think 4. All right, so we did not have anybody from OEC, DSS. Do you want to say a few things before we shift to OPM?
Hi, this is Peter Hadler again. I will just, I'd like to just note that we do have a strong referral process to the Care for Kids program. We work very closely with our partners at the Department of Labor in the administration of the Temporary Family Assistance and Jobs First Employment Services programs to ensure that participants have access to the Care for Kids program. We also work to refer clients through our Administrative Services Organization on the Medicaid side through CHN. And that is also a good referral point for us to connect folks to Care for Kids.
Great. Do we want to have the OPM representative say a few words?
Yes, I was just going to add that while, the childcare landscape has changed significantly and, we continue to monitor that and are in conversations with the Office of Early Childhood, one little bright spot in this pandemic has been, the ability for the state to utilize some of our federal CARES funds and target it towards a workforce initiative that's been spearheaded by OEC to help support parents who are re-engaging in employment efforts by providing childcare. And I think that, if we were in, better financial times, that would be, a program that we would probably want to continue to look at, and definitely is in the spirit of, the results that we're looking at with this council. So I just wanted to kind of flag that as, a bright spot in this pandemic, that we've been able to leverage those federal funds through, the workforce initiative to link up individuals' employment efforts and their childcare needs.
And do we know how many spots that has created, or?
I'm speaking off the cuff here, but I thought it was around 600 slots, and it's about $5.3 million for the workforce initiative.
So that is really great, but having lost 45,000 spots, especially with all of these, the new types of learning that is staggered throughout the week, has made this indeed quite challenging. So that's why the federal funding streams that will hopefully come after the election are very critical.
Definitely.
All right. Any other agency want to jump in and say anything about the Care for Kids program before we move on to the third recommendation? Okay, so the third recommendation is to expand rental assistance structured in ways to increase poor families' income and their incentives to work. And I think that OPM noted some funding priorities on this. So why don't we start with them, and then maybe we could go to Department of Housing. So can we have the OPM representative, please?
So this is another area that sort of plays into what we just discussed with childcare. I think, in more favorable times, we would see areas where we would want to, potentially look into additional ways to provide rental assistance for families. One of the things that we did want to note is that most of the initiatives that have been evaluated in recent years are ones where the upfront investment for rental assistance then has a positive impact on service dollars that we provide for supportive housing. And so one of the examples that was raised by a colleague was, our continued push to implement the CHESS initiative and through DSS, where we use housing supports for those individuals who are Medicaid recipients. And so that was kind of one area that we highlighted that we continue to look at. But oftentimes, because of limited resources, unfortunately, we have to look at these through the lens of, how can we provide supportive housing and then bend the curve on the service side while still maintaining positive outcomes for individuals. So that was the one thing that my colleagues highlighted when we looked at this result.
Great, thank you. Shante, do you want to weigh in as well?
Yes, just to echo with what Carrie said, there are definitely so many changes that have occurred. We have solicited projects, as mentioned in our initial response to policy recommendations, and we anticipated rolling them out during this fall. But as we know, so much has changed, the landscape has changed. So we're a bit behind due to COVID and other projects that have taken priority, like the rent relief program, for example, and that we have refocused, right, to ensure that children are not displaced and prevent children and families from being homeless. So I think it's an ongoing discussion and certainly is a priority, but as you can imagine, some of these other issues have taken precedence.
Thank you. Anybody, any other agency want to comment on this recommendation? Okay, so we will move to the fourth recommendation, which is to strengthen two generational approaches to poverty reduction by assuring that all parents have a high school degree and to take a look at obstacles and promote avenues and efficiencies to meet this goal. So the State Department of Education offered information about how they were collaborating with OEC to provide 2-gen funding to local adult ed programs for childcare so that parents could pursue classes that would get them to a high school degree. And so I'll ask if the State Department of Education just wants to tell us a little bit more about the 2-gen resource.
Certainly, and I'll jump in there, and then my colleagues can as well. And Lieutenant Governor, you did a great job in really just stating exactly where we are in working with OEC, and I believe OPM is now involved in the 2-gen initiative that is stood up. And so we're very much a part of that continued work and conversation. The funding does flow through OEC, and I know that they're not represented here today, but we're continuing to work on that initiative.
Got it. Thank you so much. Charlene, is there anyone else who would like to speak to this?
This is John Presley. I can also add, under the theme of 2-gen approaches, the department also operates the Parent Trust Fund, which is a grant program to provide training for parents on a number of issues related to their own education and supporting families in the 2-generation approach. We haven't had funding for something called parent universities in a few years, but early on, 2014, 15, and 16, we ran parent universities, which was providing opportunities for parents of kids in school to also get their degrees. So we had some success in that. And I think that funding ended in 2017.
Thank you. Anybody else on that? If not, we're going to go to the fifth policy recommendation, which is to increase participation to 85% in safety net programs like SNAP, LIHEAP, which is energy assistance, WIC, subsidized housing, and Medicaid. DSS has done a lot to see how our state can more fully participate or receive matching funding for these programs. So DSS, do you want to say a little bit about anything that you are doing in these areas?
Thank you. Hi. Yes, again, I would be happy to describe some of these things. As you noted, we do have a lot of initiatives on these programs that we play a heavy role in. In particular, I just want to note that we have been nationally recognized for our high level of SNAP access and SNAP participation. The federal government hasn't put out new statistics since 2017, but we ranked highly in the nation then and have consistently ensured that we maintain the same practices that led us to the top in the first place. We work with a lot of community partners to ensure that there's outreach with our community action agencies and federally qualified health centers on the Medicaid side. And also wanted to note on the Medicaid side as well that we have a very strong relationship with our partners at Access Health CT. Between the two of our organizations, having a shared portal and access point for clients to shop for health coverage, we really ensure that Connecticut has a very low uninsured rate compared to other states nationally. We work closely with 211 to ensure that folks have information about all the various programs that they may be eligible for and to ensure that they can get routed to the proper place, often us, to be able to determine eligibility for programs. We are participating in the 500 Familiar Faces initiative. We are a agency, along with some of the folks on this call as well, in the CHESS initiative. And we work with the Homeless Management Information System data to identify folks who are in need of assistance and or homeless as well. So there's a lot of things, and I could probably keep on going, but I'll pause there and see if anyone else has any other information to add.
Anyone else? Well,
this is John.
Go ahead. Go ahead.
Sorry, Commissioner, go ahead. So this is John Presley from SDE. Just want to highlight, in partnership with Peter Hadler and his organization, and school districts are required to provide notification to parents about the availability of SNAP. It's a state statute. So our food service operations in each school district sends out something that we refer to as Addendum C, which provides information on how to apply for SNAP. So that's a requirement for districts to send out to families every year. And so DSS and Peter Hadler Shop has helped us create that. And it has resulted in an increase in the number of families with school children who are on SNAP.
If I may note just one more point to working with SDE as well. I would be remiss if we didn't briefly discuss part of our pandemic response, which has been to ensure that families who are unable to get school lunch and breakfast have been able to access food through the pandemic EBT program, as well as we have taken advantage of all of our opportunities to ensure the maximum level of SNAP benefits during the pandemic.
And I would say that we should add that during the pandemic, our Department of Agriculture worked with the federal government to get food from Connecticut farmers to SNAP beneficiaries. And the other thing that I will add is Connecticut was one of the top states in the country in terms of having the highest self-response rate. And between our self-response for the census and the enumerated response, we had 99.9% participation in our US Census, which is critical to this point because SNAP, LIHEAP, WIC, housing, Medicare, Medicaid, and a lot of the programs that families rely upon are based on those numbers. So I think we're in a good place to maximize federal dollars for all of those programs because of the good count that we have.
Lieutenant Governor, did you say 98.9% response rate?
99.9.
99.9.
Yep.
Wow.
Yep.
That's wonderful. Whoops. Right.
So is there anybody else who wants to weigh in on our fifth policy recommendation?
Lieutenant Governor, before we move on, I just want to acknowledge that I see that Beth Bai has joined us. Commissioner Bai has joined us for Office of Early Childhood. And I think I may have seen CSCU. CSCU, are you on the line now too? Okay, no. Is there anyone other than Commissioner Bai that has joined us since the roll call?
I am on the roll. CSCU. I'm here.
Oh, yes. I thought I saw you. Okay. All right. So just for attendance purposes, I wanted to make sure that we acknowledge that we have them here now. And Commissioner Bai, we did hit on a couple of Office of Early Childhood points earlier, but why don't we try to get through?
Yep, and so what we're going to do...
Just let me introduce myself real quick. My name is Mario Garcia. I am sitting for the Commissioner G for DPH. I'm sorry I didn't, I wasn't here for the roll call.
Okay.
Oh, great. So DPH, what's your name? Can you just let us know your name again from DPH?
It's Mario Garcia.
Thank you.
Yeah, and hi, good afternoon. I'm Michael Williams with the Department of Children and Families, Deputy Commissioner here.
Excellent. So what we're going to do for Office of Early Childhood, Commissioner Bai, your homework is going to be that you're going to work with Cherie for the first 5 policy recommendations on poverty that we discussed. And that way we can just keep going. And
yep, happy to. Thank you. Yep, I'll do that.
Follow up, no big deal. Okay, so the 6th policy recommendation that we have is to promote co-parenting of both moms and dads when possible, regardless of marital status. And so I want to open this up for general discussion. And I think we'll start with DCF, and then we'll give Commissioner Bai a chance to weigh in, and then we'll go to other agencies. So DCF.
I'm sorry, could you repeat that again?
Okay, so we're talking about policy recommendation 6, which is promoting co-parenting of both mother and father when possible, regardless of marital status. So do you have anything to add right now? Did we lose?
Sure.
Okay, sure. Go ahead.
So we have been engaged in a federal breakthrough series on fatherhood in the Hartford area, where we are testing a model of fatherhood engagement and fatherhood parenting for children who have entered who are involved in the child welfare system. And it includes not only just support, but parenting, improved parental capacity through interventions of evidence-based programs. And it also includes support around basic needs like housing and food security and things of that nature. It's been a promising practice that we are looking at transporting throughout all of our offices in the state. We do have a very active fatherhood engagement initiative for our state, to where we have what is called fatherhood engagement leadership teams in every office, designed to promote positive fatherhood involvement in families or children where DCF is involved, and assuring that paternal side of a child's life is always active and involved, and have an opportunity to stay engaged and support dads when children are not able to stay in their maternal homes, if that is the situation.
Great. Commissioner Bai?
Yeah, hi. A couple of things on this. First of all, I want to echo what Michael said about the Fatherhood Initiative at a DSS. It's incredibly strong. It brings everyone together. And DCF has been doing critical work on this issue as well. At OEC, there are a couple of things. One is that in our new home visiting request for proposal, we are asking for applicants to tell us how they're going to engage with fathers, which is a shift. And in addition, as part of our home visiting program, we have initiated a program at Cebulski with men who are exiting the correctional system and doing home visiting with those fathers to help them engage with their children before and after the home visiting follows them back to the community. They may be in the same home, they may not, but they have home visitors to support continued engagement with their children because it's actually linked to improved numbers in reducing recidivism.
Great. Thank you, Commissioner. Does anyone else have any additions or thoughts about this particular policy recommendation before we move on to
DPH. Mario Garcia and DPH. I don't mean to repeat what has been presented. I think just to acknowledge that the Department of Public Health is also involved in this fatherhood initiative, what they call fatherhood audits, which is essentially looking as to what extent birth in hospitals or home visiting programs or early care settings are actually encouraging the participation of fathers in their programs. So that certainly is a collaboration with DCF and the Office of Early Childhood.
Great. Anyone else? Okay.
Sorry, John Pressley, Department of Education. I want to acknowledge Commissioner By's Office of Early Childhood. We have a partnership with them on our support for pregnant and parenting teens program. And they are the lead agency, and that has a father engagement component as well. So that's for teen moms or parenting moms, and there's a significant component to make sure fathers are engaged. And the education component of that is it allows for fathers to attend well child visits and visits to the OBGYN and things like that. So I just want to thank Commissioner By for her partnership on that.
Great.
Lieutenant Governor, John Dillon from Child Support. I just wanted to recognize that a fair number of people sitting at the video table here are all members of the Fatherhood Advisory Council. And I think that is very unique to the state of Connecticut. We really have a strong showing from a number of departments across the state government. Which I think when I talk to my child support partners in other states, I find this to be very unique and very strong here. One of the unique aspects about child support enforcement, having been involved in the program for 30 years or more, I've seen it in the early days. It held the fathers out very much as nothing more than a paycheck, and now much of that has changed. In fact, within DSS, the fatherhood initiative falls under the umbrella of the Child Support Enforcement Program, and we actually have fatherhood representatives in each of our child support field offices who work with dads along with moms. So I just to repeat what everybody has said, I think we have a very strong fatherhood initiative program here in Connecticut.
Well, we appreciate that, and that is a very good segue into the 7th policy recommendation is to...
Well, Lieutenant Governor, before you move forward, I just wanted to make sure for the good of the notes, the minutes taken here, that I also speak on behalf of the Department of Housing. This is Deputy Commissioner Hanks, and that we also partner in the Fatherhood Initiative.
Great. Excellent.
And so not willing to be left out, the Department of Education is also a partner in that initiative. In the education, we chair Domain 3, which is raising responsible parents.
Excellent. Okay. Anybody else? All right. So the 7th recommendation is to help fathers pay child support awards by bolstering job training and employment for those dads that are not paying due to lack of skills, employment, or employability. And DSS has noted that this recommendation could use a change in language. So DSS, you want to tell us how you would reword this? Because I'm sure this also can apply to moms as well, but tell us what you think. And then if you could tell us about the multi-agency program that was launched in January.
Yes, this is John Dillon. I'll start your second question first.
Okay.
Yeah, in January of 2020, we launched an effort along with the Department of Labor and the American Job Centers and our partner agency, Support Enforcement Services within the Judicial Branch. Essentially, when in many cases, when individuals, non-custodial parties, are in child support court and they are, they're underemployed or unemployed, past practice had been to essentially ask them to look for a job. In January of last year, we began working with this group to actually be able to provide these non-custodial parents the opportunity to go to the American Job Centers, to get that job training, to get that job support, and to help find them jobs or better paying employment. Unfortunately, with the COVID crisis that has impacted us, for quite some time, the courts were closed, and many of as I understand it, the American Job Centers have been working remotely. Recently, very recently, earlier this week, we had a conversation with the Department of Labor. We understand that some of the offices will be coming alive again. And where our expectation is that we will begin to again move forward with that effort. I'll be very honest with you. I'm not aware of a language change that was being discussed, but we could certainly, I can find out and get back to you.
Would you please do that and get back to Cherie Phoenix Sharp?
Sure.
I can jump in. I know what it was. It was actually, as Lieutenant Governor so astutely noticed on her own, which is that this is not just necessarily fathers, and that it should apply to all parents. And so the wording change was to just change it so that it wasn't assuming that it was just the father that this was applicable to.
That makes perfect sense. Yeah, while the vast majority of the paying individuals are dads, that is not always the case, and I think that makes perfect sense.
Great. So does anybody else aside from DSS want to respond to this particular recommendation? Okay, then we're going to move on to the 8th policy recommendation, which is to reassess the Tamp policy to avoid abrupt income cliffs and to support authentic opportunities for job training and education, and to consider expanding the 21-month Tamp time limitation to support training for sustainable employment. So we're going to start with DSS on this one, and then maybe OPM can talk about funding.
Thank you. This is Peter Hadler again from DSS. We really support this approach, and we have been addressing it, I would say, primarily through the 2-Gen Council. We've had a lot of discussions around policy changes and approaches that we might be able to take to support families in their quest for employment, and also just to ensure that they're not falling deeper into poverty. I can say from a purely policy perspective that I would really strongly support us expanding the 21-month time limit for TANF. We are one of the shortest time limits in the nation. It is very challenging for our partners at Department of Labor to ensure that folks are fully trained and connected with services to be able to rise to a level of self-sufficiency in that short of a time period. I will candidly note that it is a cost factor. For when we provide additional months of benefits, there are costs that are associated with it. So this has been, in a vacuum, it's wonderful, but I want to acknowledge the reality that there are costs associated with it.
Which leads us to OPM.
I mean, I think the only thing that I could add is that, as we continue to kind of look at, the budget and the budget crafting that we're engaged in now, and from a holistic standpoint, is that as we kind of think about, workforce initiatives and things like that, to the extent that we can evaluate things like, expanding the TANF time limit and things of that nature, that we evaluate the efficacy of those types of initiatives in the broader budget, context. And OPM is aware of the benefits of doing this and the adverse impact of the benefit cliffs churn and that impact it has on families. And so as we kind of look at the budget holistically, we have our mind's eye to initiatives such as this.
This is Beth By. I just wanted to add in on this, and to Holly's point, we have several training, childcare and training pilots going on right now with adult ed and also with CSCU in collaboration with DSS and certainly supported by OPM to try to get at the benefits of this. I also wanted to mention that with the 2Gen Council and the Governor's Workforce Council, Connecticut's been able to work with the Atlanta Fed to have a benefit cliffs tool available for Connecticut as United Way and agencies are working with individuals. We have one of the shortest timeframes there for TANF, but we are one of the only states that does not support childcare when parents are in job training or workforce training. So we are doing that now through some of these pilots and also through the CRF money. So to Holly's point, we'll hopefully have some data about how supporting job training helps parents move up and out of poverty when they have things like childcare. And we know transportation's a big barrier as well, but this is a priority of the Governor's Workforce Council to address some of these challenges of the benefit cliff.
Great. Thank you. Anyone else on this? All right, so we're going to move to the 9th policy recommendation, which is enroll more youth in programs that have been shown to reduce teen births. DPH offered some statistics about why this is important, and the State Department of Ed shared some of the program supports in place for teens who are pregnant or parenting. So can we have someone from the Department of Ed talk a little bit about those programs, and then we will go back to the group and see if anybody wants to add anything about preemptive programs. So.
Sure. The support for pregnant and parenting teens program was the federal grant I was referring to earlier. The Department of Education had that grant from 2010 to 2016. The portion that's relevant to this component, which is to reduce teen births, is that over 98% of the young women who participated in the programs over that time, we're talking about a little over 250 young women, 98.3% of those did not have a subsequent pregnancy.
And that is an extremely powerful statistic. So I wonder if there's anyone else who, outside of the Department of Education, who wants to add anything about programs that have shown or have the potential to reduce pregnancy even before the teen parenting support program is involved. Does anybody know of any of those or would like to add anything on this point?
Hi, this is Peter Hadler from DSS. I just wanted to acknowledge that DSS does operate a teen pregnancy prevention initiative. I unfortunately don't have statistics at my fingertips about the efficacy of the program, but we can get that back to you.
That is great. Nice to hear. If you would get that to Cherie, that would be great. All right, so we're going to go to the final recommendation, which is to adopt programs that help young men complete high school and enter the workforce. State Department of Ed, you talked about some of the programs supporting teen parents. And I know that there were 19 dads in last year's program. Can we have someone from SDE talk about the ways that it may be important to support young men in completing high school and entering the workforce?
I think again that the support for pregnant and teen parents program allows dads flexibilities with their schooling in order to be able to stay in school. And in many of those cases, the young dads were planning on dropping out in order to work to support now their young families. So this program works with school districts, engages school nurses, social workers, and others in the school building to ensure that dads can miss some school time with some additional tutoring and supports so that they complete their high school degree. The other program that I'll mention is the Department of Education operates the adult education program. So every district in Connecticut is required to support an adult education program, and in many cases, if dads or young people can't complete through a traditional high school program, they can obtain a number of, there are 3 different ways they can obtain degrees through the adult education program.
And I'd like to add as well that we had a Developing Tomorrow's Professionals program, which was focused on young men of color with really great results. Young men who struggled and end up at the end going to, in some cases, Ivy League institutions with a lot of support. The program is no longer funded. We're actually now exploring some philanthropic dollars to try to bring that back online.
Charlene, was that a federal or state program that was a funding stream?
It was, we had used federal dollars to support it, and then over time did not have the resources to continue to support. But it was we had got such good results that I think we need to revisit that to see how we can get that moving again.
Well, we'll see what happens after the election.
Yeah.
After, I think it's also important to point out, in addition to these great programs that really target vulnerable students who are at risk of not completing high school, there's a very deliberate attempt to make sure that all students are being given opportunities in their high school years to look for college and career pathways that can prepare them for the workforce as well. I think it's important to comment here that these efforts include pathways that lead students to jobs in the manufacturing and the healthcare industry, where we know jobs exist in Connecticut. So in addition to the specific programs that are aimed at students who are traditionally more at risk or not completing high school, it's important to share here that it's important to catch students before they disengage. So good quality programming at the core level that gets students out into the workforce or gets students to look at potential career options would make it more likely that they want to finish high school and want to complete that, and would better prepare them for either a 2-year, 4-year, or direct link into career employment in Connecticut. So I think it's important to note that as well.
Great, thank you, Commissioner. Anyone else on this last recommendation? Okay, so I think we have concluded the 10 policy recommendations that pertain to poverty. And now,
Governor, this is Shante from Housing. Can you hear me?
Yep. Go ahead,
I'm
Shante.
sorry. I don't know why I'm having these issues. It could be the weather. So I wanted to talk about our state, in this vein, right? Our state agencies have responded remarkably to support services. We talked about supplying those fundamental needs like food and housing to students and families during the pandemic. But I was thinking we should also look at the digital divide as a focus on the council, and this particular issue specifically, how it relates to training and completing high school GEDs. Access to Wi-Fi will likely impact that training and educating of parents that we've been discussing. We already know that it has impacted our students, that are being educated via distance learning. And, our concern is definitely that it does not widen the achievement gap that already exists. We're also seeing that this lack of access to Wi-Fi is even impacting families being able to complete the rent relief application and submit the documents that are needed for that electronically. So I understand that right now it may not be a well formed out policy recommendation that we can submit, but I would definitely welcome to be a part of future discussions so that we could possibly draft a future policy.
And I actually, Shantae, couldn't agree with you more. And if the commissioner doesn't have any objection, why don't you and he or someone in his area go ahead and do that, because there's been a lot discussed since the pandemic began in March about this, and there's a lot that's been done, and there is more to do. So I definitely think it's worthy of including. And is there anybody that disagrees?
I would give a thumbs up to that, absolutely. A quick summary of what's happened to date is that we've collected needs from our school districts that reflect the disconnected students, and we've responded to every single one of those. And whether those families are connected yet, not at this point or not, it's in process. The broader conversation is also getting every adult connected to and getting them those digital literacy skills that you mentioned. So the Governor's Everybody Learns initiative supports connections, more than 70,000 connections to families with school-age children. So that will address the sort of boxes and wires side of it, as well as 80,000 computers, as the commissioner knows well. But I think looking at a sustainable sort of policy-based approach to digital literacy and closing the digital divide is absolutely critical to ensuring that every citizen has access to the services and the opportunities, lifelong learning, all those advantages that come with being a digital citizen.
And I think that we should have some statistics included about, what this looks like for the last school year, where 176,000 kids never logged on to their online, and we're doing better this year, but it's still in the thousands, and we just can't afford to have those kids not online. So I think that is a very good point. Shantae, thank you for raising that. It's absolutely critical, and it's something that everybody's been talking about in the pandemic, and it's something that probably wasn't on everyone's radar in 2014. So thank you very much for that.
Thank you, Doug, for the quick update, and Shantae for the comments. I think what I could do is have Kari maybe set up a conversation with Desi Nesmith, the Deputy Commissioner, and Irene Parisi to kind of get an overview of it. But considering policy recommendations, I think it is a great idea, given that not only have the recommendations changed from 2014 till now, but also from February till now, the needs are much different in Connecticut. So codifying it based on what we know the governor's plan has done, but what is still needed, I think makes sense.
Okay. Great, thank you, Commissioner. So what we're going to do now is we are going to turn to hunger and food insecurity, and Commissioner Cardona is going to lead our discussion as his department had responses to each of the policy recommendations. So Commissioner, I'm going to turn the hunger and food insecurity portion over to you.
Thank you very much, Lieutenant Governor. And thank you everyone for your contribution to the ideas. And we hope to continue the conversation going around hunger and food insecurity. The goal here is to make sure that children will be food secure and fueled to learn. If any of you can recall back to some of these Zoom meetings or some of these go-to meetings you've been on that maybe have gone on for 3 or 4 hours and your stomach starts grumbling, you know your ability to learn or to be engaged meaningfully diminishes, right? It's harder to learn if you're hungry. It's harder to learn if you're thinking about your next meal or where it's going to come from. So what we want to do is make sure that in this work to address achievement disparities and put our agencies work together, we address some of those basic needs that, if you recall from your psychology courses, the Maslow's pyramid, you know, food, shelter, you know, those are basic needs that are critically important as students learn and grow. So with that, I'm going to ask that we go through some of the policy recommendations. You see them on the screen there. The first is about ensuring that students receive the nutrition required. And, you know, from the opening bell of the day. And today's a good day to talk about this because, as you know, districts have the opportunity now, while I don't believe anyone took advantage of it or needed to, remote days on inclement weather days or snow days. But the requirement is that food is made available to these students. So I'm going to ask folks from our agency to jump in here to talk a little bit about making sure the nutrition that's needed is required, but also maybe talking a little bit about how we incorporate that into the school breakfast delivery options in our state. Charlene?
Sure. And before John, who really oversees the programming for our school nutrition programs, jumps in, you will see, and Kari, maybe you can just scroll, these policy recommendations are very tightly woven together. It's on the school breakfast program. It is about incorporating meals, some options about grab and go meals and all that. So John will just give us the context for everything. I think that will be helpful. John?
Sure. So with regard to the Department of Education oversees, you know, several different meal programs for school children. The National School Lunch Program, the School Breakfast Program, there are summer food service programs. There are also childcare food programs. And so through all of those programs, the kids in Connecticut, we serve approximately 78 million meals annually through all of those programs. And that brings in just over $180 million to the state every year in reimbursements for districts. And so a couple of specific actions that we've been engaged in over the last couple of years is increasing the number of schools that provide school breakfast. So in the last decade or so, we've added over 300 school breakfast programs, and more than half of those programs that were started actually occurred in our severe needs schools. So in Connecticut, that means about 890 of our 1,100 schools participate in the breakfast program. The other significant initiative that Connecticut adopted, the federal provision called the Community Eligibility Provision. So a number of important requirements in that provision. Number one is you have to serve meals to free for all children, which really gets to the meat, if you'll pardon the pun, for all students having nutrition every day. But it also requires that those schools participating provide breakfast. So that's been a significant increase in the number of kids who get 2 meals per day in Connecticut.
John, because I think it's going to come up as a question later, and I think people are thinking about it. You know, in the spring, we shut schools down. By mid-March, schools were shut down until the end of the year. Could you talk a little bit about some of the creative ways districts made those meals available and made sure that students had access to those meals, including breakfast?
Sure, thank you. So we were able to take advantage of a number of federal waivers in the federal child nutrition programs. One major area was shifting to more of a summer meals program model. What that allowed is that every one of our programs was allowed to serve any child aged 18 years of age or younger if they came to their sites for meals. That's significant because in Connecticut, we have thousands of students who go to school outside of their where they live, right? So this allowed them to get a meal in their own neighborhood without having to travel to a magnet school in another town to get a meal. It also waived the requirement that the meals be consumed on site. And so families were able to come and get meals and take them home. School programs did a number of really innovative things. They packaged meals for several days, so families would only have to come out once for a week's worth of meals. They packaged bulk meals, so instead of including 12 half pints of milk for the week, they were able to give a couple of quarts, and families were able to work out the meals over the course of the week. So all in all, from the time we shut down in mid-March to the end of the school year, schools served approximately 12 million meals.
And can I just say, I had the opportunity to visit grab and go sites, Meriden, Middletown, Norwich, New London, Waterbury, Norwalk, all over the state. And it was just incredible. And school systems had this up and running really quickly, which was critical. Otherwise, people were going to be hungry. And I just think you all did a great job. So let me just say
this is Mario Garcia from DPH. I'd like to ask John if you could speak a little bit more about the coordination with other benefit programs. And as you know, you and I worked years ago when you were WIC director at DPH. And my question is, or maybe you want to talk a little bit about how you coordinate in the schools with other programs like WIC and SNAP, and actually the food pantries, in the sense that students seem to be a clear indicator that some problems are in the family. And if you can recognize the problems in the school, maybe you can coordinate with other programs to make sure that families are also getting the benefit of additional with nutrition. So is there anything on that area of coordination?
Are you referring to sort of in general or during the COVID?
In general, I didn't mean to refer specifically to COVID, unless that's where we are. But yeah, I was thinking.
Sure, a number of ways in which this occurs, right? So another program is our at-risk after-school supper program. So schools, in addition to providing breakfast and lunch, can participate in the childcare food program, but serve suppers actually in their schools. So that means that those kids are able to participate in an after-school program or some kind of an enrichment program, and then get a third meal for the day. When we shut down for COVID, certainly many programs partnered with community-based organizations to not only use their facilities or use their locations to provide additional information, but also to provide resources for family members to obtain meals in those communities, so that parents were able to come and pick up meals for their kids. But this was an opportunity to say to parents, you can get meals at such and such locations, or you can get additional resources at such and such locations as well. To your point about feeding the rest of the family. The other significant partnership with Peter Hadler's team and Commissioner Gifford's team at DSS is our direct certification system. So Connecticut's actually received national recognition for the efficiency and effectiveness of our direct certification system. And what it does is Peter Shop sends us a weekly download of all of those families that are on, all of those kids and families that are on SNAP, TANF, and now through a special pilot program for Connecticut for children in Medicaid households. So Peter sends us that every week on Sunday night. We download it and we match it with our school database, and we match those kids' names. So every week, any family that's enrolled in SNAP for that week gets added to the list, gets matched with a child in a school system, and gets downloaded to the local district. And so that's been unbelievably significant in that the number, particularly when we adopted the pilot program for the Medicaid program, an additional 70 to 75,000 kids were directly certified. So that means a number of things. Those kids get meals, but even if they were getting meals for free before, there's no longer an application process to fill out. The schools don't have to follow up with families. There's no verification of income and all of those things because it's already done. So that partnership has been absolutely invaluable with making sure that our kids get, for kids who are eligible for those meals, get those meals.
Thank you, John. And thank you, Lieutenant Governor, for mentioning earlier about the food distribution that had to evolve like overnight. And because this is a public meeting, I think we all feel the same way, that our food service employees in our school systems are also heroes, and they really stood up. This was March, April, during the height of the pandemic in Connecticut. They were there serving meals, giving bags with days worth of meals for larger families. And, we're pleased with that. John mentioned a bit about the direct certification program, and he talked about the CEP program, the Community Eligibility Program. It's really important when we talk about food insecurity affecting students' ability to learn and contributing to achievement disparities in Connecticut. It's really important how significant those programs are. So the CEP program, no longer are families have to be chased down to fill out an application, many times in a language that they don't understand, or they're working, and children are also getting nutritious meals. Many of you may know that, when students have balances, before there were headlines around cheese sandwiches being given to kids because they didn't pay their bill, didn't have their application filled out. That removes all that. That removes that scarlet letter, if you will. When you have direct certification, the child gets a meal. If you're a part of a CEP district, which means the entire district is eligible, you don't have to deal with differentiating a lunch because a student didn't pay the meal, didn't pay the price. All students are given the same meals, and it removes some of those other barriers that, if you're a 7-year-old walking through a cafeteria line and somebody's saying, hey, you owe money, and you don't have money on you, that removes that. So I think these are some of the maybe the benefits of this that we're not talking about, we may not realize, but when you're walking into school, you can tell the difference when all students are able to benefit from a nutritious meal, something that they really like, and not have to worry about having school staff track down families to try to get them to fill out an application. That's, again, not the best way to use the staff in the schools. So those are two really big programs that I think John talked about. John, to give our Kari an opportunity to catch up, because I know she's taking copious notes there, and I know that the notes kind of could be spread out. Could you talk a little bit about extended day programs, summer programming, so that we can kind of round out school-based food insecurity strategies? Thank you.
Sure, absolutely. So our one of the ways which we collaborate internally is we make sure that all of the after-school programs, including the state after-school program, the federal after-school programs, and the after-school programs after our priority school district funding, we coordinate to make sure that they're providing meals or snacks to those kids as well. So that's an opportunity to find a home, if you will, for some of those meals. With regard to the summer program, we operate a number, close to 700 sites over the summertime, and through a number of collaborations, we collaborate with DPH, who actually provides us with some with health inspections at those sites. So those are nice because they get us out in the community, and we partner with community organizations to provide meals. Traditionally in the summer, a non-COVID summer, we usually issue up to 2 million meals between July and August. We have about 37,000 kids on a daily basis come to those sites. Connecticut is actually second in the nation in the number of those sites that provide 2 meals per day. We're second only behind New York. So that's a significant accomplishment to make sure that those kids not only can come and get a lunch, but can get a breakfast and lunch as well.
Thank you, John. And, to round out the section on food insecurity, and I think Mario's question kind of led us here already. Can you talk a little bit about the SNAP benefits with DSS and what connection is made there so that we'll make sure we're providing the food for students that need it?
Sure, and so I want to mention that the DSS has been a tremendous critical partner in all of this. Again, as I mentioned, the way the direct certification program happens is really starts with DSS in a number of those. But the reverse is also true, right? So as I mentioned earlier, we make sure that our families get information about how to apply for SNAP. There's an interesting relationship between the SNAP program and the school meals program, in that if you apply to the school meals program and you're not eligible, if you're above 130% of the federal poverty level, not to get too technical, the way the SNAP program works is Connecticut has adopted a higher threshold for eligibility for SNAP. So you can be 150% of the federal poverty level, apply for school meals, not be eligible, but if you get on SNAP, then you're automatically categorically eligible for free school meals. Doesn't seem to make sense, but that has allowed us to really make sure that families not only get eligible for their kids for school meals, but also get all of those benefits from SNAP and from temporary family assistance and others. And also, once they get to DSS, then they can make sure they're connected for healthcare as well. The other piece I wanted to mention is for DCF or Commissioner Durantes, her team sends us actually the list of foster care kids on a monthly basis, and those foster care kids are also get downloaded into our system and matched with our database to make sure that those kids are eligible for free meals as well. Obviously, other categories that are eligible include homeless populations, migrant populations, and others. So we collect all of those to make sure that all of those kids are getting free meals.
Thank you. So the collaboration between agencies is alive and well. This is the Interagency Council, right? So, and I have to say that over the last several months, DSS, working with the pandemic EBT was really helpful too, and thank you to DSS for that. And DCF, obviously, we've been working more closely now, given that we're trying to help our children through the pandemic and the families. Thank you, John. I want to pause for a second and ask members of the council if they have any other questions or any comments, recommendations, or thoughts on any of the food insecurity items that were discussed now.
Hi, this is Peter from DSS. I would just thank you for your excellent description of the work that we've done together, John. This has been a really successful partnership, and I just wanted to note that the pandemic EBT process sort of took our direct certification and really augmented it. We were able to provide benefits to all of the families who were in those CEP districts who may not otherwise have been enrolled in SNAP. So we were able to get a lot of benefits out to a lot of people in need during the time when schools were closed during the pandemic. And the partnership has been very successful, and we're looking forward to continuing it as there's been additional funding authorized through the federal continuing resolution that was passed at the end of September. So we're working on expanding PEBT during this time, and it'll really help a lot of families. I just also want to note that it's important that the outreach that is being done by SDE continues, because right now in particular, families who may fall between, say, that 130% of FPL and the 185% that SNAP currently has as an eligibility ceiling will be able to receive emergency allotment funding during the pandemic, which allows families who might otherwise get a small SNAP benefit to get the maximum SNAP benefit during the pandemic. So this can really be a helpful program for those families who are maybe on the bubble or just over the income threshold normally, to be able to access a lot more funding to be able to help ensure that their nutrition needs are met. And one last thing I'd just like to chime in is that we have, and it may be hot off the presses, but we just received approval for a federal grant for operating a summer EBT program, which really helps us to provide assistance to the neediest children during the summer months. We're excited about this. It just came out today that we were approved, and we are one of 4 organized states nationwide to be able to access this funding. So we're continuing these excellent partnerships to make sure that we have a rounded ability to be able to assist students year-round.
Thank you very much. Thanks for sharing that. And it is good to see the interagency work happening. Before the pandemic, but during the pandemic even more so. So, Kari, I'm going to ask if you could, and I know you're working really hard to try to catch all these notes, but could you just make sure that we covered all the food topics and the recommendations in our in John's descriptions? Did we get them all? Could you maybe scroll down to see some of the other items?
So do we spend a day food programs? Is that the last one?
We did the extended day. Schools acting some marketing, school, I don't know. Our meals, we did that. Yeah, I think. Yeah, that was it.
We could parse through the notes to make
Kari,
sure.
and maybe Kari afterwards, if it makes sense to maybe move some of the notes from the first block to the block that it actually applies to. We know that was probably impossible with the rapid speed that we got all of the wonderful information, but just for purposes of organization afterwards, we can just maybe move some of the points to the right block.
Absolutely, that won't be hard to do at all.
Thank you, Kari.
Thanks, Kari.
You're welcome. And congratulations on the grant, Peter. I'm very excited about that. On receiving the federal grant.
Always nice when the federal government is doing something right. Always good. So we are going to ask if anybody has anything to add to hunger and food insecurity. Okay, so what we're going to do is now we're going to move to the social emotional health prevention and intervention. And because the State Department of Education really had some great responses, and for each of the policy recommendations, we are going to go back to Commissioner Cardona, who's going to lead our discussion on social emotional health prevention and intervention. Commissioner.
Thank you very much, Lieutenant Governor. So the goal here is really to make sure that all children will be emotionally stable, resilient, and capable of self-regulation. Now think about how important that is in any educational setting. Now think about the impact that pandemic has had on that. So everything that was important before is more important now. So while we will discuss some of the strategies that we've taken and how we're trying to meet these recommendations that were set forth by the council, we'll also talk a little bit about maybe what we're doing post-pandemic or during the pandemic, so that we can bring attention to some of the strategies that have been done more recently. So the first one is really expanding the access to mental health care. And I know Deputy Commissioner Russell Tucker will kind of walk us through some of the strategies that have been taken and talk about some of the things we've done specifically during the pandemic. So Charlene, could you take that first one, please?
Sure. Thank you, Commissioner. I often think about this report that was done in 2014. And here we are, Commissioner, I guess you can take a bow and some of that. Here we are in 2020 with the pandemic, and this is even more critical now than ever. And so we are working certainly with a lot of providers, including the school-based health centers that are in many cases very well positioned in school buildings to make sure that schools are indeed supported in this space. And I know John and his team have also been working very closely there as well. The issue of the stigma of mental health, a critical area that we continue to work on to make sure, and when we now talk about social mental health and to improve academic outcomes, we're also, based on the pandemic, thinking about the traumas and even for our educators and others, staff in that space that needs to support. So clearly, John, I know you work very closely with the School-Based Health Center Association. Anything else to add there?
No, really just that we work closely with DPH. DPH licenses, I believe, 90 or 92 school-based health centers. And so we work with their team over there about some of this reports. And and also with the Association of School-Based Health Centers, we've been in contact with them throughout the pandemic. And they are really eager to take a very active role in supporting behavioral and mental health for students.
And I want to cue up my colleagues from DSS, DPH, or DCF if they'd like to share any of the work that's happening around mental health support for students in schools. And while they're preparing their thoughts, I just want to comment that the school-based health centers have recently stepped up in raising their hands and saying, maybe we could be the implementers of Binax Now testing, the antigen testing that's been made available recently. So, you know, the partnership on mental health support and behavioral health support for our students is extending now to fill the void of some of the testing needs that we have in Connecticut. And I just want to acknowledge the fact that because those relationships are there and the partnerships in our schools are there, we're able to tap on that relationship to go further with testing in Connecticut. Colleagues, anyone else want to share anything on school-based?
From DPH, I'd like to comment that in addition to licensing, DPH is also working with the Office of Health Strategy on issues related to access to primary care. And certainly school-based health centers are critical providers of primary health care. And so we support the notion of expanding the services and the connectivity that school-based health centers have to have with the general health systems. And that's looking outwards from the school. So the school-based health center connecting with primary care systems, but looking inwards in the school. I think the relationship between school nurses and school-based health centers also has to be strengthened, particularly school nurses being sort of like the ones that enter into contact with children primarily in a more routine basis, who can detect all these behavioral issues and can work in coordination with the clinic to initiate counseling or whatever is needed. So I mentioned this because recently the Office of Health Access has created this committee for primary care reforms and related initiatives. And I'm not entirely sure whether the Department of Education is part of it, but if it's not, we certainly need to be part of that conversation on how the enhancement of primary care points, particularly within the school system, can help to improve services for children.
Thank you. Anyone else?
Hi, I'm just going to chime in. I know that my partners over here at DSS have shared a lot of information about the work that Husky Health does to ensure coverage for behavioral health. It's not my personal area of expertise, so I can quickly say that I know that we've been working closely with the Department of Education and our local schools to be able to ensure that we have a broad array of coverage, and that we are looking at ways to expand that coverage on the premises of schools, and planning to review our ability to access 1115 waivers, continue to experiment on ways that we can expand coverage.
Thank you. Thank you.
At DCF.
I guess we did talk.
Please jump in, Deputy Commissioner.
Sure. So we're in the process of moving our behavioral health plan for children to a stage of actualization. That's a plan that we were directed to create with all our partner agencies to comprehensively address the mental health, behavioral health needs of all children in the state of Connecticut. We've been working diligently on a couple of items, but right now we think we're at a point where we can do some really great and amazing things, even though it's not school-based. It's a plan that will equalize access and equalize outcomes for all children, and looking at places where there's disparate access in certain zip codes in our state where we know, and looking at those evidence-based practices that are in place that should support children's behavioral health services that really don't get to children of color, particularly older youth of color in schools, where police are called prior to a mental health intervention or emergency mobile psych services. So we're creating this system that we think can be fully integrated, very comprehensive, and owned by all the state partners to really improve the well-being of all kids 0 to 18 in Connecticut. So that's an exciting initiative that we're about right now.
Yeah, it is. Thank you. Commissioner Bai, I see you're unmuted. I didn't know if you wanted to jump in.
I did. And I'm sorry, I just was on with local health director, so I'm back.
Oh.
Michael and Commissioner Durantes, I can't thank you enough for your leadership on this. And the meeting yesterday was so exciting about the behavioral health pre-birth. We even talked about prenatal through age 18. So we really do need a coordinated response, and DCF has been taking leadership on that. There are several things going on at OEC related to social emotional learning. Some of it intersects with SDE. Commissioner Cardona and our teams have been working together implementing a framework called the Pyramid for early childhood, some in public schools, some in private programs, which is a framework for supporting children's social emotional needs. And we've invested some dollars there. But probably more significant on the social emotional health is the home visiting work that we're doing with families to support social emotional health prenatal through age 5, so that when they get to school, they've had this. I don't know, that they've had some support and intervention for the families that are at risk. I don't know, Commissioner Durantes, did you get to talk about ECCP?
No, we didn't, but I think this is a good way to incorporate it. ECCP is an intervention that reduces suspensions and expulsions of children in preschool and kindergarten settings by incorporating some coaching and clinical intervention with the instructors as well as the parents of those children. And we've seen tremendous success in terms of the outcomes, so much so that OEC and DCF have contributed to more slots for ECCP to be able to replicate that and continue to measure the success and outcomes there.
Yes, and I know, I don't know if it's with you, Charlene and Miguel, but I know that the village has been piloting ECCP up through 3rd grade. So it's called the Early Childhood Consultation Project, and it is mental and behavioral health services to help kids who are at risk of being expelled, as Commissioner Durantes said. But the outcome data on this intervention, I don't want to misquote, but I know at least 97% of children who get enrolled do not get expelled. And we were seeing a lot of kids be excluded. And believe it or not, kids are more likely to be kicked out of preschool than they are K to 12, significantly more likely. So there's a real problem that Michael referred to yesterday in our meeting of how many times programs are calling 911 for children as young as 3, and kids are languishing in ERs because there's no place to send them with preschoolers. So ECCP is a really cost-effective way to help with this.
That's fantastic. Thank you. And because I know the Lieutenant Governor starts her meetings on time and makes sure they end on time. I'm going to limit my comments to say how the intersect between all this work is critically important. And, I appreciate that. And I believe it's Mario's point from DPH earlier, we would love to have that conversation continue. And I must throw in a plug here for when we talk about primary services, medical services, there are children whose toothaches are being treated in the schoolhouse. And if you think it's hard to learn when your stomach is grumbling, think about how difficult it is to learn math or reading when your teeth hurt. So the school-based health centers do provide a major service, and we want to continue to expand those. So Charlene, what I'm going to ask you to do, if possible, is please continue connecting some of the dots. So we talk about MTSS being a strategy and PBIS, and then the community school or the wraparound programs. Could you talk a little bit about that and how those strategies are being implemented?
Commissioner and Deputy Commissioner, just a quick note. Kari, my apologies, but we should have DSS, and he noted it earlier, in the second column for that first recommendation. They did offer a written response about Husky. So I just want to make sure that that's included for the accuracy of our notes. But apologies, keep going.
Thank you.
Thank you very much. And as you can see, and it's great to hear or other agency contribution and the need for us to right? That's why we're here, the Interagency Council, to coordinate and align so that we can have the maximum benefit. The commissioner mentioned, multi-tier system of support, which is really a construct that says we tier the level of the support. Not everyone needs the same level of support. You start with a tier 1, which is what everyone would need. And then for those who need additional support, you need to the next level of support. And then the third level of support. And that is how we are really facilitating all the work that we're doing together. And one of the programs that we reference in the next recommendation is Project Aware, which is a joint project of SDE, DCF, and the Child Health and Development Institute, which is a federal grant, a 5-year federal grant specifically to address student mental health. And we selected, there were 3 targeted districts that we were working with to develop really better coordination between state, local, and mental health providers, similar to, like some of our providers that were previously mentioned here, like the Village and others, to support our districts and to provide training for staff on the front lines, as well as training for families and support for families. And so we are doing that work. And I go back to something we talked about earlier. When we have these programs to support, federal dollars to support programming, and sometimes we have good results, we've got to find a way to maintain and sustain and the sustainability of that. So right now, even before the federal grant hits for Project Aware, we started to share information with our other districts that may benefit. They may not have the federal dollars, but as they're looking at the use of other funds, how do they start incorporating what we're learning in those strategies into the work that they're currently doing? Similar to what Commissioner Bai just talked about, how do we scale those programs and services? So that is really where we are. And as soon as we learn more about other programs that other sister agencies are doing, to be able to incorporate that. And just in general, for behavioral health supports, we're now having conversation. I know John is leading some of that conversation with DSS about how do we use Medicaid funding to support the work in behavioral health supports in district. John, for a second, do you want to just chime in as to how that's going?
John, you're muted.
Yeah, let's figure out how to unmute. Thank you, Charlene. Yes, we prior to COVID, we had a great conversation with the team at DSS. The idea is that we know we have a number of supports already embedded in the school system. We have school counselors, we have school social workers, we have school psychologists, and a number of other support personnel. This really expands that to open it up so that we have community behavioral health providers actually embedded in the school, and not just to provide one-on-one tier 3 services, but also sort of to open it up so that kids can be all kids in all schools can avail themselves of some of the work that's being done around behavioral health. And it seems as if there's an opportunity through Medicaid reimbursement to support some of that work. So we're going to be pursuing that pretty significantly going forward.
I'll also share for making sure that school social workers and all that have access. We just did a webinar with some of our health partners, John. I know you facilitated that webinar with some of our providers to make sure that basically to showcase some promising practices about how schools are working with providers around behavioral health services. And we're bringing those partners back together to have more conversation as to how we can scale the work that's happening there as well.
Thank you. In the 6 minutes we have left to cover this area, I'm going to ask Charlene if you could look at the bullets and the strategies and kind of just talk a little bit about that. But before you do that, I want to take a step back and just remind everyone on the call, today's focus is really on poverty, food insecurity, and social emotional well-being as levers to address achievement disparities in Connecticut. And these are some of the strategies that are taking place to target those 3 areas. So what we'll do now is spend the next 5 minutes, Charlene, just kind of going over, and I think Kari's going to be cutting and pasting because she's taking notes, but they do feed into each other. So Charlene. So I think what's left is linking school and community resources and helping youth receive mental health treatment rather than correctional assignments.
Right. And I'll start with the latter one, Commissioner, because Commissioner Bai already talked about the program, one of the programs. But I also want to talk about our effort, again, cross-agency with DEMAS, with SDE, with court support services on reducing school-based arrest and funding of the Child Health and Development Institute in a Connecticut school-based diversion initiative that was implemented and now funded. We now have state funded to support it. And what we've seen is that this particular program also with promising results, 34% reduced court referrals since the program started, 47% more students referred to behavioral health services versus calling 911. So they're calling 211 to get a mobile crisis intervention services instead. And those are the collaboration and the work that's happening there, certainly very promising. And we're making sure that we can also go to scale and bring more schools into that. So certainly we should be continuing to do that, and also looking at the program that Commissioner Bai talked about, which I think are critically important. So linking and making those school and community resources connection is a critical part of the work that we're doing now, and really intentionally making those connections across all our systems and helping our districts figure out how to utilize all the supports and services that becomes available to them. So I don't know if our colleagues at DCF or DSS want to add anything else to that, but I recognize that we are time challenged.
No, it's just to echo your accurate description of SBDI and the incorporation of CHDI and their leadership in this particular area. DCF and its development of this particular area helps to ensure that it is, the emphasis now is making sure that it is applied consistently across those areas where we know there are trouble spots across the state.
Thank you. Thank you, Commissioner. And I think, what's obvious to everyone on this call is in order for us to improve the social emotional support of our students, we have to build the capacity of the adults that work with the students and make sure that the systems are designed to support students. I think the line that I saw from Commissioner Durante's slides yesterday, we were on like 3 calls yesterday. One of them said mandated, to go from mandated reporter to mandated supporter. I love that. That's the role, right? And how do we build the capacity of the adults and the systems that serve our students? I think those strategies talk to that, to make sure that our schools have the right tools in their toolbox to meet the changing needs of our learners. And because this is an interagency council, meaning we're going to kind of be in union together, I'd be remiss if I didn't acknowledge and congratulate our very own Kari Sullivan in the union that she had this month. She was married this month. So congratulations, Kari. Kari Sullivan Custer. Congratulations on your
wedding. If we're going to do that, then we have to congratulate Cherie Phoenix Sharp and her husband, Shadid, on the birth of Shair in August. So,
Congratulations. Thank you.
So, Lieutenant Governor, that wraps up the 2 sections there that I was asked to cover, and I want to turn it back over to you. Thank you.
Excellent. I appreciate that, Commissioner, and the State Department of Education for your partnership. And we have now had the opportunity to review the 2014 recommendations, and I would just congratulate Shante on bringing to Shante Hanks for adding that very important piece about the digital divide. And I also want to thank Kari for taking notes. Kari, we appreciate that. And we're going to ask OEC and Commissioner Bai to just make sure that the first few, I think it's the first 5 recommendations, poverty, you just take a look to add some words. And if anybody else has anything that they would like to add, please let Cherie know and or Charlene Russell Tucker, and we will put it in our comprehensive review. So for your calendars, our next meeting is going to be December 10th from 1 to 3. And what we anticipate doing at that meeting is look at the policy recommendations on housing and early childhood education. We may have a guest speaker, but if we don't, we will likely add another subject. So we will keep you informed as to what the agenda is. And we're going to go ahead and adjourn, but we don't want to do that unless anybody else has any comments, questions, or announcements before we adjourn our meeting.
Lieutenant Governor Vanessa from DCF. I just wanted to make sure that we look at the overlap with some of the planning on the federal Family First Prevention Services Act. Connecticut is in the process of developing its prevention plan, and all of the buckets that were discussed today kind of fall into those further upstream efforts that prevent children from coming into the child welfare system or going into the juvenile justice system. And so we will also provide just a brief overview summary to include in this, because I think, to Commissioner Cardona's point, the more we can talk about integration and collaborative efforts across state agencies and across branches, the better and more comprehensive this plan and all of the efforts going on across the state will be.
So I like that a lot, Commissioner. So when Kari finishes her notes, she will get them over to you. And if you could have folks at DCF add in comments pertaining to that federal program, I think that would be really great. And we'd love to include those. So that sounds good.
Certainly, thank you.
I just want to jump in and add something here. So just as a reminder, there are a lot of policy recommendations included in the 2014 report. It would certainly be impossible for us to have tried to fit them all into one meeting, but there are some other sections, that we obviously haven't covered today and that we won't complete in covering in December. There is a family engagement section, so I encourage you all to look at some of the other sections. It may very well be that some of the things that we've touched on today are also applicable in other areas, but we wanted to just try to at least separate this out into groups to help us with some of the things that make sense to do together, some of the things that make sense with time management, some of the things that are particularly pressing. And we also tried not to inundate you too much with asking you to respond to every single policy recommendation that's in the report. We certainly wanted you to review all of it, but we did ask you to respond to things that particularly touch your area. That doesn't mean that you may not touch another area that we didn't necessarily specify for you to respond to. So I just really want to encourage all of the council members in the effort of really working together and working, interagency as we're intended to do, to just take a look. And that's why these meetings are so important, because even if you haven't necessarily specifically responded to something, once you start to hear what other people are doing in other agencies with respect to that, you really might have something in your own agency that touches on that. So just to reiterate some of the Lieutenant Governor's comments from earlier, some of the things that were recommended may be brand new to state government. Some of the things may not. Some things may not fit nicely in one agency, but that's why we really want to work together to consider how to address some of these things. So just please feel free at all points to circle back to that full report. Look at the different subject matters, look at the different recommendations. It could be that some of the things that you're thinking fall in line with something else, even if they weren't discussed today or aren't discussed in December. But we do plan to keep this format going for each of our quarterly meetings until we complete a review of all of the recommendations, and we'll certainly be talking about next steps along the way. And your feedback is always welcome. And with respect to that. So thank you all for joining us.
Three, with that, are you suggesting that Commissioner Durantes hold those comments to another topic area, or would you like her to provide comments for the items we've discussed? today?
I think you can provide the comments, Commissioner Durantes, but also look at the family engagement section, because your comments may apply to both. And we will at some point get to family engagement as well. So I just want to make sure that we as a council are staying connected with how all of these things connect. So if they apply here, go ahead and provide them. I just want us to also look at some of the other areas that are relevant also.
Great suggestion. I'll take a look at the whole thing.
All right.
This is Mario Garcia from DPH, and I'd just like to take a minute to follow up on Commissioner Durante's comment, because the Department of Public Health has been working with a large coalition for state health improvement initiatives, and we are putting together a plan for the next 5 years. We call it Healthy Connecticut 2025. That is due to be launched early next year. But meanwhile, we have developed a set of drafts of the plan, which is somewhat distinct from other plans in the sense that this is not so much disease-oriented, but the plan is going to address the issues of health from what we call the social determinants of health. And we have basically outlined 4 buckets. 2 of them had to do with community strength and resilience, and another one has to do with food and homelessness. So I think there is a lot of strategies that have been proposed through all this planning, which essentially have been proposed by many stakeholders and residents of Connecticut throughout the last probably 12 months and different events. And so there is a lot of overlaps with the ideas that have been discussed today. So I will be happy to share some of the drafts just to consider the approach that this plan is taking and to see in what ways we can contribute to enhance the recommendations that you are presenting. So looking forward to have that conversation.
Very good. All right. So everyone, are there any other announcements or comments? Excellent. I want to thank everyone so much for their participation and this meeting of the Interagency Council for ending the achievement gap or eliminating the opportunity gap is hereby adjourned. Thanks, everybody.